If you danced when you were younger, you might have felt like you had great turnout. And now as you've gone through life and your body has changed, your turnout has also changed. And that doesn't mean that you can't still dance beautifully. But that does mean that we have to start approaching turnout and the way that we're working with our bodies a little bit differently as we become more mature dancers. In this tutorial, we'll explore how your turnout changes over time, how to measure it correctly, and how to apply it safely in ballet positions. So let's first start by talking about how your joint and the structure can actually change over time and affect your range of motion in a turned out position. So there's a few reasons why your turnout may shift and change over time. One, that's joint structure and cartilage. The shape of your hip socket and femur can actually change over time with degeneration and affect your range of motion in turnout. Ligament laxity decreases. As we're younger, our ligaments have more mobility, and as we get older, those ligaments do tend to tighten up. Muscle balance and strength. As we get older, we may tighten up or weaken in different areas based on what we're doing in our everyday life patterns. And because of those things, we can see changes in our turnout. Now, that's not to say I haven't had dancers who actually feel they have better control of their turnout as they have gotten older. And that particular phenomenon is usually because they were never fully accessing their turnout as a younger dancer, understanding how to activate the deep rotators or hold their core in neutral. And then as an older dancer, they've gained that kinesthetic awareness to fully activate and correct their turnout. Surgical history. Depending on if you've had surgeries or injuries in the past, this will affect your ability to turn out. Having a hip replacement will affect your range of motion in turnout, but based on which procedure you have, this is going to determine how much range of motion you're going to have following those procedures. So let's talk about how I'm going to find your turnout and how we're going to measure it. The first thing I want to talk about is the butterfly position. And this is often a poor choice for dancers who have limited mobility, any kind of low back issues, or senior dancers who are not able to actually sit up, hold neutral, and open their hips to external rotation. If the dancer is doing anything like sitting back on their sacrum and rounding here, unable to fully engage through the spine and bring themselves forward while lifting their heels, then this is not a position that we want our dancers to be in, because it's going to put a lot of stress on the low back as well as get a skewed measurement at the hips. So my alternative is to have the dancers start out in what we call hook lying. So that is a neutral spine on the floor with the knees bent and then just spread about hip distance here. When we measure turnout passively, that means that we're just seeing how far the hip can externally rotate without changing anything at the spine or pelvis, and then bringing it back in. So against gravity, we have gravity coming down on us right now, and we're trying to keep the pelvis nice and still and just open the leg to the side into external rotation. If you feel your pelvis twist and then your leg goes down to the floor, or you've got more range of motion that way, this is not a true indication of your turnout. So when we're here in this hook lying position, our goal is to, 1, make sure this low back does not come off the floor. That doesn't mean tuck and lift. It just means your core should be relaxed and engaged against the floor here, not in a gripping way, but in a way that the spine's stabilized and protected. 2, both hip bones need to be on the floor the entire time. So as I rotate my leg out to the side, I'm going to stop where I feel my body try to turn or compensate, or even my back lift off the floor. This is a great thing you can do, and then you can see how much range of motion you actually have in this position. This is a great activity because your spine is held in neutral. You're able to really feel the floor and give yourself feedback that you have all points of spinal contact in place, and then allow your hip to just nicely open to the side. You can do the other hip at the same time if you feel like you have the control, but watch that you don't allow your hips to actually shift towards the side that you may have more external rotation in. If you've had a surgery on your hip, injury, or replacement, you're gonna notice that one side has more external rotation than the other, and we wanna be sure that we're not rolling towards that side or away from that side. While both my legs are externally rotated passively towards the ground, I'm gonna lift my heels up to keep a line between my knee and my ankle. If I have my heels down, this is sickling, so we're not trying to reinforce this position. And we also don't want to push our heels up so high that we break that line. Ankles are excessively everted here. So you're just trying to bring yourself in that position where your knee and your ankle are in a line. You're externally rotated at the hip with the core engaged against the floor, and both hip bones are pointing to the ceiling. You can see in this observation of my passive range of motion that I have a little bit more of a limitation on the left than I do on the right. And this can tell us a few different things about our range of motion here. I may have some tightness in my adductors and in my actual inner thigh region that is limiting my ability to just allow this hip to relax to the side. I also may have a more shallow hip socket on the left. Just because I know my body and I know what's happened to it as well, I've had more injuries on my left side, which means my body on the left side is probably going to tighten up in a response to that. And I know a lot of you are probably asking the same question right now. So do you have to work your left side harder when you're in ballet class and turn it out more to compensate for that difference? And as far as safety goes, my general principle for myself and my students is that if you have a significant imbalance in your turnout, you shouldn't be working the right side to end range and left side to its personal end range, because then if you look down at your first position is not going to be symmetrical, right? So what I do actually is, of course, I'm gonna have that conscious effort on working my left side, doing whatever I can to remedy or improve the left-sided deficit. However, I will pull back my right ever so slightly because I don't want to force the left into a more turned out position. And then as a domino effect, it affects other parts of my body on my left and right side, which can lead to compensation and injury. In the next video, we're going to be exploring how to apply that range of motion that you just learned and you felt on the ground to standing up and getting into ballet positions.